Ladies and gentlemen, good afternoon and welcome to the University of Liverpool. For those of you who may not know me, I'm Professor Sally Sheard. I'm the Executive Dean for the Institute of Population Health. And inaugural lectures are one of the highlights of my year. It's an opportunity to celebrate, to come together. In this case, it's for Professor Charlotte Hardman and her friends, her colleagues, and her family, who I know are sitting 3-4 rows back. So welcome to you all as well. So the format for this evening is that I will do an introduction, Charlotte will deliver her lecture, and then there's an opportunity for questions. And Professor Joe Harold, who's Dean for the Department of Psychology, will chair the Q&A session. There's a couple of pieces of housekeeping first. If the fire alarm goes, then we will evacuate through the marked routes, please, and meet outside. We're not expecting any fire alarms. And can I ask, please, is there anybody who would not like to be appearing in public photographs, because we have our photographer here? Everybody happy with photographs? Brilliant, thank you very much. One individual sitting there. Two. You don't get out of that, Joe. No. Okay. Thank you. So it's my great pleasure to introduce Charlotte to you. Charlotte is Professor of Psychology of Eating Behaviour in the Department of Psychology, where she's also our Impact Lead and Director of Postgraduate Research. Charlotte's a founding member of the Liverpool Food Growers Network. We may have some in here this evening. We do. Nice to have you. Thank you for coming. And that strategically connects groups, organisations from across Liverpool City region to grow fresh local food and improve health. Charlotte's a trustee as well of Feeding Liverpool and a member of the National Food Standard Agency's Advisory Committee on Social Sciences, which is a really significant national role to have. Charlotte first joined the department in 2013 as a lecturer in psychology, and prior to that she gained a first-class degree in psychology from the University of Leeds, where she graduated in 2000. From there she moved to Bangor to a research assistant post, and then she moved to a postdoctoral research associate role. And in 2009, Charlotte moved to the Department of Experimental Psychology at the University of Bristol. And she took up a postdoctoral research associate role there with Professor Peter Rogers. And that was looking at the biopsychology of appetite control. Having joined the University of Liverpool with us here in 2013, she was promoted to senior lecturer in 2018, and then Charlotte achieved a chair, personal chair, in 2023. As Charlotte will discuss this evening, her research focuses on the psychological determinants of eating behaviours and the application of this knowledge to developing interventions that can facilitate healthy and sustainable diets for all. Her research has played a leading role in shaping the better understanding of complex issues of obesity, food insecurity, and it highlights the need for holistic approaches to transform the food system in the UK and beyond. So please will you join me in welcoming Professor Charlotte Hardman to give her inaugural lecture.
Thank you very much, Sally, for that really kind intervention, that very kind introduction. Hello, everybody. It's really lovely to be here this evening to deliver my inaugural lecture, Eating for Public and Planetary Health, Navigating Complexity and Tackling Inequalities. Thank you so much for coming. I'm really very grateful. I'm aware that this evening clashes with a certain football game, so I'm particularly grateful to you for showing up. Just one thing I must say is please don't tell my dad the score. He's waiting to go home and watch it at the end, so don't spoil it for him. So we will get started. And just to give you an overview of what I'll be talking about today, I'll start with a brief career background just to tell you how I got to where I am now here at the University of Liverpool. And I'm then going to introduce the main topic that I want to talk about today, which is the issue of obesity and the food system. And in doing this, I will particularly focus on the complexity, the inequalities, and the real challenge in how we shift people to change their diets for public and planetary health. I'll then reflect on some potential solutions based on my own research, and then finish with some final reflections and take-home messages, and there will be a Q&A afterwards. So I just want to be really clear what I mean when I talk about eating for public and planetary health. So this essentially means eating foods and following a diet that is good for our own health, but also for the health of the planet and our natural environment. So this would involve eating more plant-based foods, more fruits, vegetables, pulses and whole grains, and fewer animal sources. So what we see here is that we have these sort of dietary win-win behaviours, good for health and good for the planet. And it's particularly well established that we need to be significantly reducing our consumption of meat because of its very high environmental footprint. So my academic background is in psychology. I've always been in psychology departments. And as a teenager, I was really fascinated by the idea of studying psychology and this idea of studying the science of human behavior. So I decided I wanted to do psychology as my undergraduate degree. I chose the University of Leeds, which is a wonderful psychology department, and it's particularly renowned for its expertise in appetite research. While I was there, I was taught by Professor John Blundell, who is one of the leading international figures in this area. And I would love to say that that is what attracted me to the University of Leeds, but my reasons were much more superficial than that. On our open day, after being toured around the department, our tour guide took us over to the Union and we all had a pint. And I just thought that was great and that sold it for me. So there you go. But I've had a fantastic 3 years at Leeds, graduated in 2000, and then wasn't really sure what to do. I thought about a PhD, but wasn't quite ready to commit to that 3 years. And then I remember getting an email about this research assistant post at Bangor University. And this was sort of a real light bulb moment, because prior to that, I hadn't really realized that you could do research as your job. I'd always thought that my lecturers were teachers and that research was something that they just sort of did on the side. So this was really exciting. I applied for the job and I got it. So this then meant a move to Bangor in North Wales. I joined the group of Professor Pauline Horn and Professor Fergus Lowe. And I actually stayed in Bangor for 9 years, first as a research assistant, then a PhD student, and then finally as a postdoctoral research associate. So as many of you who've known me a long time will know, at Bangor, I worked on the Food Dudes Healthy Eating programme. So the Food Dudes programme is an evidence-based intervention which was devised by Fergus and Pauline based on their long-standing programme of research into the psychological determinants of children's eating behaviour. And centre to this programme are the food dudes themselves. So these are superhero characters. They eat lots of fruit and vegetables and they get special powers from doing this. And I should just say this intervention was aimed at primary school children, by the way. So what we're doing here is we're harnessing the principles of social learning. We know that learning from others is a very powerful way of acquiring new behaviours. And so the idea here was to present these positive peer models who the children would want to copy. And we also used rewards to encourage children to start to taste the fruits and vegetables, because as anyone who has had children will know, this is incredibly challenging, and children are often very reluctant to try new vegetables in particular. So this is all about trying to get children to repeatedly taste so they can learn to like the flavours, because again, we know this repeated tasting is a very strong determinant of preference and intake. So as a research assistant on this project, I was straight into schools on the ground, collecting data to evaluate the effects of the intervention on children's food intake. This was not a glamorous job. I was often to be found hovering around a bin with my clipboard in the school canteen, rooting around in lunchboxes and weighing apple cores. But we were really rewarded with some very nice data which showed sustained increases of this intervention on the children's fruit and vegetable consumption. And I also got my first academic paper. And this intervention has been really influential in this space. It's still widely regarded and referenced over 20 years later. For my PhD, I wanted to adapt these principles and look at a different behaviour. So I focused on physical activity, and we devised a similar intervention. So we had the fit and fun dudes. We used pedometers to give children step targets, which they were challenged to achieve each day, and they got a small reward for doing so. And again, we got some really nice results here with children showing significant increases in their physical activity, which again were maintained at follow-up. So what this shows is that we can use this knowledge of psychology and apply this to real world health behaviours. And working on these projects just gave me this fantastic insight into how the theoretical learnings that I'd acquired during my undergraduate degree applied in the real world to actually really change people's behaviour. So after being in Bangor for 9 years, I was ready for a move to the University of Bristol, where I joined the Nutrition and Behaviour Unit in the Department of Experimental Psychology. And I was working here with Professor Peter Rogers and Professor Jeff Brunstrom. And I joined this really dynamic group of early career researchers. This was a very stimulating and exciting environment to work in. Peter and Jeff, as mentors, are just so creative and innovative in the way that they address important theoretical questions about appetite control. So I was really lucky in this role because I was generally given free rein to develop my own ideas with the support of these very strong mentors. I did lots of different studies. One I'd like to particularly highlight is the dopamine study, where we used a dietary challenge involving different combinations of amino acids. And the net effect of this is to produce short-term decreases in dopamine, which is a neurotransmitter in the brain, which is important for motivated behaviors. And this enabled us to uncover the role of dopamine in food-related behaviours. And consistent with other work, we found that when we reduce levels of dopamine, we see a reduction in appetite, which would be consistent with dopamine's more general role in motivated behaviours. So all of this experience put me in a very strong position in 2013 to be able to apply for a lectureship here at the University of Liverpool. So I joined the department, I joined the appetite and obesity group. This was a really exciting move to me. The group are internationally renowned for their expertise on appetite and obesity research, and there are really first-class lab facilities in our department. This picture was taken not long after I joined the group, and of course you can see our wonderful Professor Jason Halford there in the middle, and our other group leader, our wonderful Professor Jo Harold, is not in this photo, and I think she must have been hiding on that day. But I was really lucky to join the group also alongside Professor Emma Boyland and Professor Eric Robinson. We all joined around the same time, so it was really good to have these fantastic colleagues as my peers. And I think we can see some other faces in there. I can see Dr. Beth Mead, who is hiding there at the back of the photo, for example. So I guess I just want to reflect on having moved around a lot during my early career, and I really want to acknowledge that James, my husband, has always been really willing and happy to follow me around, move up and down the country for my job, and I'm really, really so grateful for that. So we had our daughter Amelia in 2009 when we were in Bangor. We then had to move down to Bristol, and then it was about moving back up to Liverpool. So James is a former University of Liverpool graduate himself, so he knew that Liverpool was a great place to live. And he's also a lifelong Everton supporter, as is Joshua. How could you possibly tell? So I didn't really have to persuade James very hard to move to Liverpool, although I'm not sure that supporting Everton has actually ever brought him that much joy. But we've really loved working and living in Liverpool. It's a fantastic place to bring up a family. All the best things happen in Liverpool. We get Eurovision, we get Taylor Swift. So what more could we possibly want? So I'm going to move on now to, I guess, what I really want to talk to you about. which is this issue, this really complex issue of obesity and the food system. And the next sort of section of this lecture, I'm going to go through some sort of background and context setting before I start to delve into some of the detail and my research findings. But I guess just to say, I first became interested and really aware of obesity in 2001 when the National Audit Office published their very influential report, Tackling Obesity in England. And then we fast forward to 19th of June 2024, and again, headline news is all about obesity. And I think this really shows that over this time, obesity is still a major issue. It's still at the forefront of public health agendas and really needs to be addressed. According to the World Health Organization, in 2022, 2.5 billion adults globally were living with overweight and obesity. But what's really important to understand about obesity is that it is incredibly complex and it has very many causes. So what you can see on the slide there is the obesity systems map. This is obviously very complicated. You can't read half of those boxes, but that's kind of the point. It's really about showing that complexity. And there are so many causes, and these are likely to be different for different people. So what this really tells us is there is not going to be a magic bullet or some sort of magic cure that will work for everyone. We need multiple interventions tackling all elements of this system. But this is not well understood in public discourse, particularly in the media, and unfortunately within political parties. All too often, obesity is reduced to a simple issue of personal choice, and people are blamed for their weight. And we know that this is an incredibly harmful approach. All this does is generate stigma and shame, which doesn't help anybody at all. So, for example, we know that biology plays a very strong role in determining someone's weight. We know that their genetics, that's really, really important. So for some people, they're fighting against biology, and I'm going to talk a bit more about how that is particularly difficult in modern food environments. And I just want to give an example to really highlight this complexity. Obesity often occurs with mental health. So someone living with obesity will often also be living with a mental health condition. Now, losing and managing weight is really, really hard, but it is even harder if you also have a mental health illness. So in some research I did a few years ago with Professor Pravitha Patilay from University College London, we really wanted to understand how this relationship between obesity and mental health starts to develop. So we studied a very large sample size of children who had been followed up over a substantial period of time from childhood, early childhood through to adolescence. And essentially what we found here was that obesity and emotional problems are more likely to occur together and also to develop together from mid-childhood. So from the age of 7 onwards, obesity and mental health problems are more likely to go hand in hand. And so this has a number of implications for how we approach childhood obesity. It suggests that in treatment, we really need to be thinking about mental health and taking that into account. We need to address underpinning psychological distress rather than simply targeting diet and exercise, which will often be outputs or consequences of underpinning psychological distress and mental health. So it's always really important that we're tackling root causes rather than tackling downstream consequences. And I think another valuable insight from this sort of work is that prior to the age of 7, we don't see obesity and mental health, emotional problems occurring together. So this suggests there could be a window of opportunity for prevention where we focus actually on trying to promote healthy dietary behaviours and also positive mental well-being. So when we published this paper a few years ago, it did get quite a lot of media interest. So the BBC picked it up. I got to go on Women's Hour on BBC Two, which was really fun. I got to go on BBC Breakfast. And I think what this sort of said to me was actually people didn't really know this stuff. And what I did find also was that quite a lot of people reached out to me. So, for example, on what was then Twitter, I had someone tell me that having seen me on BBC, their simplistic view of child obesity had changed significantly. I was really pleased by that. I think the more people we can educate about this, the better. I had members of the public reaching out to me saying that this really resonated with their own personal experiences of living with overweight and obesity as a child, and the stigma they experienced, in this case from a medical professional, and just how that made them feel. And then the one in the middle, so this was a lady who she got in touch via email. She asked me to send her some more information. I think I sent her a conversation article that I'd written with Carl Roberts, actually, and she got back in touch, and she said she was going to print it off and she was going to make her husband read it, and then he would just stop parroting, "Just don't eat so much," as though it was really that simple. And I think, again, this is a very common occurrence for people who live with obesity and overweight. They are told, "Oh, well, you know, just do this, it's simple." And it really, really isn't. It's so complex. And this lady was kind enough to say, "You may well have provided the information which will help me get hold of my life." And I really hope that that was the case for this lady. So I'm just going to broaden the lens a little bit now, and I do apologise, I did say that this was all about complexity, but what we also need to think about when we're thinking about obesity and diet is the wider food system. So the food system is essentially farm to fork. It's how our food is produced. It's how that food gets to us. It's how we acquire that food within our food environment, and then how it eventually gets to us as consumers. And I think what's really important to understand about the food system is that we're very concerned, because at the moment the food system is not delivering on health and environmental sustainability. So particularly when we think about the consumption end, so we're repeatedly being told that we need to eat more fruit and vegetables, we need to eat less meat, all these sorts of things. But that really does not align with our food environment, because when we walk around our food environment, we are constantly being bombarded with reminders that tasty food, which is high in calories but low in nutritional content, this tasty food is available. Whether that's seeing billboard signs, it might be seeing advertising on bus stops, or just going into stores and your favorite tasty food is on offer. Now, of course, it's not to say that we shouldn't eat these foods. You know, it's always nice to have treat foods, but we really shouldn't be eating these sorts of foods every day. And I think it's pretty fair to say that the way our food environment is set up just really isn't matched to what we're supposed to be eating according to dietary and health and environmental sustainability guidelines. And just something else that I want to just raise very briefly is the importance of our brain reward system. So we have a system in our brain, the reward system, which is really, really attracted to these high calorie treat foods. That's just the way our brain works. And it's thought that we evolved this system in our evolutionary past when we used to have to go and forage for food. So it would have been really adaptive to have this sort of system that can motivate us towards sources of calories, because that would entail survival. So that was all great when we were hunter-gatherers, but now we live in a very food plentiful environment, and this sort of system actually is really poorly matched with this abundance of food that we find ourselves in. So when we think about it like that, it's actually really not surprising that we have so many people struggling with eating and weight, because we're really not well suited to the sort of food environment that we currently find ourselves in. And just one other really important point to mention here are the inequalities that we also see across the food system, and also the inequalities that we see in obesity and health outcomes. So we're hearing a lot more about food insecurity recently. So food insecurity refers to a lack of secure access to sufficient amounts of safe, nutritious food for normal growth and development and an active and healthy life. So food insecurity is a major issue across the world, but increasingly in developed countries like the UK. In 2022, it was estimated that 7.3 million adults, or 14% of households in the UK, were living with food insecurity. But that is likely to be an underestimation, and I'll say why in a moment. And sort of a key issue here with food insecurity, it's predominantly affects people on lower incomes, and it really reflects key issues around affordability. So firstly, pretty much any more healthy food is likely to be more expensive per calorie relative to a less healthy food. And we also often find that it's much harder to access healthier foods than unhealthy foods. And I alluded to that earlier. But we particularly see this issue in lower income areas, which are often called food deserts. So these might be areas where there is very poor access to healthy foods. There might only be sort of small convenience stores. So to give you an example, there's a convenience store near where I live in Liverpool, and I went in there to look for some vegetables, and I found the fresh fruit and vegetables section, and it consisted of a lemon. And the rest of that shop was just walls and walls of chocolate, confectionery, sweets, crisps, all that sort of convenience food. I'm obviously lucky I have my own transport. I can move around and go where I need, but there are very many people who do not have that luxury. And so if you're in a food desert area, if you're struggling, then it is incredibly difficult for you to access the nutritious food and the food that we're supposed to be eating as well for environmental sustainability. And I think then, quite unsurprisingly, we're seeing food insecurity associated with lower diet quality and also with obesity. Just a couple of just something else I do want to say about food insecurity is that when you talk about food insecurity, people often say, oh, well, that's using food banks. And yes, people experiencing acute food insecurity will use food banks, but food insecurity is not the same as using a food bank. Food insecurity is on a continuum, so there will be variability in the extent to which people experience food insecurity. There are many households experiencing food insecurity who will never go to a food bank because their needs just aren't deemed to be acute enough. So that's why I said earlier that these sorts of figures, which are based on food bank use, will often underestimate the true extent of food insecurity in developed countries. So I think before I start to delve into some of the detail and some of the research, I just want to pause and do a little recap and just check that I just still have everybody with me. So far we've been talking about obesity and food systems and how these are really complex systems, and we have multiple underpinning inequalities within these systems. And it's the groups on lower incomes who are most affected. And the socioeconomic inequalities that we see in access to healthy diets and rates of obesity are also likely to drive broader health inequalities. So this really is a major concern. So I guess the key question is, what do we do about it all? So I'm going to give you some insight into some of the research I've done, which has really just sort of scratched the surface of this very complex topic. But I guess, firstly, I think it's absolutely critical to understand the lived experience and the perspectives of people who are experiencing food insecurity. If we're going to devise interventions to address food insecurity, we have to understand the lived experience. That is absolutely fundamental. So this was a study I did. This was before the cost of living crisis, where we went to a food bank in North Liverpool, and we interviewed 24 people who were using the food bank, who were kind enough to give their time and provide their valuable perspectives and their experiences. And just to sort of summarize the key themes that came up, we were really interested to understand what was their experience of shopping for food, and particularly shopping for healthy food. What might some of the barriers be? What came out really clearly was income. This was just after the changes to the welfare system. People were living on these incredibly meagre universal support budgets, and they talked about this constant struggle of managing on this very limited budget. The money just wasn't enough. The cost of food came out again as a really key theme, which just echoes what I said earlier about affordability. But what I think was really interesting was pretty much everybody who we spoke to valued eating healthily. They knew about eating healthily, but they could not afford to do so. And that is something that we've really consistently found, as have others, is that it's not about lack of knowledge and awareness. Although, again, that's not really commonly discussed. People talked about accessibility to shops, as I've mentioned, and they also talked about the strategies that they engaged in to conserve their food. So people were skipping meals, they were eating smaller portions, cooking in bulk and freezing. And for parents with children, they would always be prioritizing their children. So many of the people who we spoke to were also living with health issues. That might be a physical health condition or a mental health condition. And that really impacted on their ability to go food shopping and on their ability to prepare and cook food from scratch. So this is something that we really need to be taking into account. And then people also talked about this sort of cycle of worsening health, where having this very low income, lack of access to food, poor diet and poor eating patterns actually was worsening their physical and mental health. So in this way, people seem to be stuck in this vicious cycle that was really, really difficult to break. So we've looked at this in other ways, and I think sort of a second important point here is that we really need better understanding of the psychological experiences of food insecurity. And by doing this, this can help us to develop targeted interventions that are better suited to individual needs. So in this research, this was a larger study. We had around 600 people in this study, and these participants varied in the extent to which they were experiencing food insecurity. We had some people with high levels of food insecurity, and then there was sort of a continuum with people having increasingly lower levels of food insecurity. And here we found that having higher levels of food insecurity was associated with higher levels of psychological distress. And then that distress in turn was associated with eating as a way of coping. And this is thought to be a really critical mechanism or psychological process that could explain this link between mental health and then having a higher body weight. So this is where food eating is being used as a way of reducing emotional distress. And in this particular study, people who did that were more likely to have a higher body mass index. So I think, again, this speaks to the intricacies of these relationships. It echoes my earlier findings, which highlight the link between psychological distress and obesity. But I think here we're adding in food insecurity to that equation, and we're also adding eating as a coping mechanism and really highlighting that this is something that we need to be aware of in interventions to support people with eating and body weight. So in more recent work, we've been particularly focusing on the cost of living crisis because, of course, for the past, well, almost 2 years now, we've really been in this grip of crisis where energy prices have absolutely soared, food prices have increased, but people's income generally hasn't increased in line with these other increases. And so this has seen even more people experiencing food insecurity and food budgets becoming increasingly squeezed. So I have a project at the moment called FioFood, which is a large project with several other university partners. It's led by the University of Aberdeen, also in partnership with Sainsbury's. And this project is all about understanding the experiences of people living with obesity and food insecurity, and then using this knowledge to devise new interventions in retail settings, so specifically in supermarkets, to help with the purchase of healthy and sustainable foods. And as part of this research, we've been doing quite a lot of work trying to understand sort of what is the current state of play, how are people coping with the cost of living crisis. So these are just some results from a study we recently did with almost 600 people who are living with obesity. So we asked about the extent to which people had been impacted by the cost of living crisis. And we found that people who'd been more impacted were more likely to report higher levels of food insecurity, as you might expect. But I think what was really interesting here was the sorts of strategies that people were engaging in to mitigate this impact. So people reported greater use of budgeting. So particularly they were cutting back on healthy foods to avoid other essentials. And the reason people are cutting back on healthy foods is because healthy foods are more expensive. So if your budget is really, really squeezed, then you can only buy what you can afford. And it almost seems like healthier foods are seen as a bit of a luxury. People were also using more supermarket offers, using more energy-saving appliances like air fryers and microwaves to save on energy costs. And people were also being really resourceful in the way that they were approaching shopping, cooking, and waste. So I think sort of what this really highlights is the resourcefulness of people who are experiencing food insecurity. And essentially, people are pretty much doing everything that they can to manage on these very limited budgets. But of course, there are many things here which are outside of people's personal control. So we can't control food prices, for example. We can't control the fact that healthier foods are more expensive. So what can we do? Okay, well, yes, we can look at supermarket offers and deals, but they are almost always on the less healthy foods. So it's a real challenge. And the work that we're doing in FIOfood, we're really keen to start to unpack this and understand where there might be potential solutions. And I just want to acknowledge Dr. Rebecca Stone, who you can see there on the slide, and I know she's listening on Zoom, but Rebecca's been an absolutely fantastic postdoc leading this research, working with myself. So something else that we did following on from this was we simply asked people, well, what would help? And you probably won't be surprised to know that the top most helpful interventions were all based on price. So people really wanted to see price discounts on healthy food, money off promotions, rewards on supermarket loyalty cards. And when asked about what would be least helpful, again, you're probably not that surprised to know that all of the interventions around awareness and education, so labelling, that sort of thing, they were rated as not being very helpful. So again, this speaks to this issue around people don't want more education. They don't want to be told what to do. They actually want it to be made possible for them to access healthy and sustainable foods. And so this project is ongoing. It's a really exciting project. So we're capturing loads of really valuable insight from the lived experience of people experiencing food insecurity and obesity. So we're finding that people are conscious and restricted consumers. They're doing everything they can within their agency to mitigate the rising food costs. And this is taking a huge emotional toll, and there is a lot of stigma around someone's weight, but also stigma around their food insecurity status. But what we're also doing in this project is we're capturing the retailer's perspective. So we have Sainsbury's as a partner on this project. But in this particular study, we worked with 7 staff members from the major UK supermarket retailers, which collectively represent 85% of the grocery market share. So we've been collecting their insights to get the retailer's perspective. So what they're telling us is that supermarkets are really committed to health and sustainability. They're already doing quite a lot of things, but it's very complex. And I think that's been very valuable learning for me, is to really understand that supermarkets are also operating in this very complex system. It's really not as simple as just making everything cheaper. So what we're moving on to do and sort of next steps with this project is trying to bring all this together and sort of start to see, well, where can we meet in the middle and where might we be able to co-design solutions that work for everybody. So we will be looking forward to sharing those results soon. So in this final part now, I want to go back to the food system and go even further back to thinking about production and how our food is produced. This is really important, where our food is coming from. A lot of the fruit and veg that we see on supermarket shelves is imported. It's travelled a long way, so there's a lot of food miles, environmental footprint there. And this fruit and veg is often also imported from countries where water is very scarce. So in another piece of research that I've been doing over the past few years, what we've really wanted to understand is, can we flip this on its head? And so actually, could we grow more fruit and vegetables in our local towns and cities? So this was a project called Urban Revolution. And this was all about ruralizing urban areas through food growing and the potential of doing this to create a healthy, sustainable and resilient food system. So this was another interdisciplinary project which I was part of with the Universities of Lancaster and Cranfield. And we started this project with a number of questions about how growing more food locally in towns and cities might benefit people and the planet. And we hypothesized that there would probably be quite a lot of benefits. So we're thinking about growing more food close to where they live, growing fresh food, then this can really start to address and speak to these issues of food deserts and potentially then facilitate dietary choices. I've talked quite a lot in this lecture about mental health, psychological distress. And there's a very strong evidence base that spending time in green spaces and gardening has positive effects on well-being and stress, and can also bring people together and develop better social and community cohesion. And then there are all sorts of potential sustainability benefits, so sustainable food production, resilient supply chains. So that's really important. Think about during COVID when suddenly all our shelves were bare. So if we can grow more food in our local areas, then potentially that can lead to these more local and resilient supply chains. And then the environmental impact of doing this just really wasn't well known when we set out to do this project. And I think something that's perhaps a bit different about this project is we didn't just focus on one type of food growing. So when I used to talk to people about this, they'd always say, oh, you mean allotments? Oh, well, it's really hard to get an allotment, all that sort of thing. Allotments are a part of this, but they're not the only way that you can grow food if you live in an urban area. You can grow food really nicely on a balcony, for example. You can also grow food in your community. And through doing this research, we really got to learn a lot about the fantastic community food growing projects which are happening throughout Liverpool. And I'll talk more about that in just a moment. We can also grow food in a really, really innovative ways. So I have a PhD student, Abby Williams, who I think I might have seen sneaking in at the back, I'm not sure. So Abby works also for a really fantastic organisation in Liverpool called Farm Urban, who are pioneering new ways of growing leafy greens vertically using soil-less hydroponic and aquaponic systems. Abby's been doing her PhD research on this, looking at the well-being and dietary benefits for people. So it'll be really exciting to see some of her results being shared in the next few months. And I guess just sort of the other thing I'd like to say is this isn't new. We did this during Dig for Victory when we had to. That was a time of clear crisis, but arguably we're in a crisis now. We're in a health crisis. We're in an environmental crisis. So maybe this is really time for us to really sort of step up and go back to something that we knew worked in the past. So I'm just, in the next few slides, going to take you through some of the findings. So I guess one of the first things that we wanted to understand was, is there a relationship between food growing and diet quality? So on this project, I was really lucky to work with Dr. Beth Ann Mead as my postdoc. So Beth led a lot of this research. So in this study of around, or just under 600 people, we looked at a range of different people, some who were involved with food growing and some who weren't. And we found some interesting associations. So people who were more involved and engaged with food growing tended to have better diet quality. And we found that this was explained by people being more motivated to make healthier and more ethical food choices. So just to be really clear, this is a cross-sectional study, which means that this was all measured at one point in time. We can't tease out causal relationships. We don't know what is causing what here. We can only talk about associations. But one thing that we did do in this study was control for socioeconomic status, which is a really obvious confounder, and we found that the results did still hold. So this was some quite promising initial work. Then this project actually coincided with going into lockdown in 2020, which on one hand was really annoying because it scuppered all of our plans for exciting face-to-face research. But of course, the COVID-19 pandemic actually created this shock to the food system where we suddenly were finding empty shelves, and people did get really worried about food supplies, particularly people who were having to shield. So we used this as a window of opportunity to collect some data. We put out a survey to ask people about whether they were growing their own food. And we found, again, some interesting differences here. So people who grew their own food at home had higher well-being scores compared to non-growing. So again, we're seeing this evidence of well-being coming through really strongly here. And we also found that people who were growers had lower perceived food insecurity scores compared to non-growers. So in this sort of moment of when there was this sort of a moment of food shortage, that the food growers did seem to have some sort of protection from well-being and worrying about food, which again is quite promising. So some of the work that went on this project with the wider teams, this geospatial analysis was led by our colleagues at Lancaster University. So what they did was that we took several towns and cities in Great Britain, including Liverpool, and we looked at how much green space there was in these particular towns and cities. And then we were able to estimate that if we used all of the urban green spaces in these towns and cities, then this could support 4 times domestic production and imports of UK grown fruit and vegetable categories. So just to put that into perspective, that would be more than the recommended dietary guidelines of 5 a day of fruit and vegetables per person per year for the local populations of these towns and cities. So in Liverpool, if we were to use all of the green space, then that would enable everybody in the city to achieve their 5 a day for a whole year. Now, of course, we're not going to use every single bit of green space. We're not going to start ploughing up parks to grow potatoes. But this does really speak to the potential here. If we were to use more green space, then there really is a lot that we could do and potentially address many of these big challenges that we currently experience, particularly around access to fresh produce. This article got quite a lot of media interest when it came out, but I think my favourite headline was the one from the Daily Star: "Urban farming will feed a lot." That one was quite good. And I just want to go back again to talking about food security. So this is a really nice review, which Beth Mead published earlier this year. So this is where we really were able to broaden out and consider not just our own evidence, but also the wider literature on urban food growing, urban agriculture, and its potential to contribute to food security. And I think sort of key messages that came out of this review was, first of all, there's not a huge amount of evidence available. But the evidence that is there suggests that urban agriculture makes a modest but positive contribution to food security. And this appears to be because growing food in urban areas increases the availability of and access to fresh fruit and vegetables. But another nice finding that came out of this review was that urban food growing can also support skill development, social connections, and well-being. So again, this starts to speak again to these broader benefits that we might see from this sort of approach. It's not just about diet and access, there are also many other benefits. And I haven't got time to talk about it today, but the Lancaster team also did some really nice work looking at the environmental benefits. But Beth's review also set up some research recommendations, and I think some of the future work that we will be doing in this area will be particularly focusing on these areas. But it's clear there are issues with existing literature. We need better measurement of urban agriculture and food security. So what do we actually mean? How are we measuring this? We need more rigorous reporting of research practices and data analysis. So we need to use better methods, essentially. And also that we need to consider the lived experience of food insecurity and community food growing. And I think around that last point, I think in Urban Revolution, we really did do that. We went out and spoke to a lot of community food growers and learned a huge amount from these really amazing organisations and people who have so much knowledge about how to grow food. I'm always really in awe of the local knowledge and expertise that you find in our local communities. And off the back of Urban Revolution, because we met some really fantastic people, we met Lucy Ansell and Minna Alonka-Falola, who are sat in the lecture today. Really great to see you. So we met these really great people who are doing such amazing work in Liverpool around ensuring better access to food, tackling food insecurity, and then also tackling food waste, which is so important around developing these circular economies. So we were all really inspired to come together to set up the Liverpool Food Growers Network, and I got some impact acceleration funding from BBSRC, one of our major research funders, to support this project. So the network has gradually grown over time. We've had some funding from Wellcome and more recently funding from the Liverpool City Region Combined Authority. You can see on our map there that we're connected with a number of community food projects throughout the Liverpool City region, including Wirral. And I think, again, what I just want to say is food growing does not just happen in affluent areas. People say this to me a lot, or this is just a middle class thing. I can absolutely tell you it isn't. If you go to Toxteth, if you go to Kensington, Everton, there are amazing community projects where people are coming together. They are growing food. So obviously, producing food that feeds people, but also there are so many other connections and benefits, the social connections, the well-being, which people involved in these projects report. But unfortunately, so many of these projects are charities. A huge amount of people's time goes into this unpaid. So much is based on volunteers. And we know that ultimately this is very difficult to sustain. And it would be really great to see some proper investment in this area. I just want to flag something as well that we're working on, which is really, really exciting. Along with Feeding Liverpool, the Food Growers Network, Compost Works and Feedback, we're working with local groups to support Incredible Edibles Right to Grow campaign. So Incredible Edible are a national organisation all about growing your own food. And they are spearheading this campaign at the moment, which is all about changing the law to speed up and make it easier for people to access land in their local areas for community growing. There are often unused patches of land in communities which are just going to waste. They might have loads of fly tipping, for example. And we know that communities want to take control of these lands, these areas, and make them nice spaces that everybody can enjoy. So that's what this campaign is all about. Feeding Liverpool at the moment are running a petition. And if you go to that QR code, that will take you to all the relevant details. If you did want to support this campaign, it would be great. And I know there was a really great event yesterday at Everton Community Garden, which I wasn't able to go to, but I know Lucy and Minna were there. And then something else about this campaign, it's really nice to see that our evidence from Urban Revolution is underpinning this, and particularly our geospatial modelling study is being cited quite a lot as underpinning, supporting scientific evidence. So that's great to see too. And I guess probably sort of the last thing I just want to talk about is again, still focusing on growing our own food and growing food in the UK. I'm just going to finish off by talking about beans, because I have another project at the moment called Bean Meals. And this is all about transforming the food system using beans, but using special beans that have been grown in the UK. So our partners on this project at the University of Warwick have pioneered a new way of growing navy and blonde kidney beans in the UK. So normally these bean varieties would all be imported from North America, obviously then with a very high carbon footprint. So this is a really exciting innovation. And on Bean Meals, what we're looking at is, can we get these beans into schools, onto school lunch menus? And what happens when we do that? So my team have been working on the ground in 6 primary schools in Leicestershire, applying this whole food approach where the beans are on the menu, the school cooks are given free rein to put them in whatever dish they want. And I can tell you that bean pizza so far has been the most popular. But we also know from a huge amount of evidence that it's not enough to just make these foods available to children. And I saw this right at the start of my career in Food Dudes. We need to increase children's motivation, their interest, their desire to actually consume these foods. So we took this really we've taken a whole school approach here, where children engage in a lot of fun activities, educational activities. They've been learning about beans. They've co-designed their own board game, which is all about the story of beans and the food system. And you can see them having great fun down there playing that game. So this game was co-designed. So it's actually been designed by children for children. And we know kids really love playing it. And my wonderful postdoc, Dr. Natasha Bays, has been on the ground in the schools. And something else that Tasha's done is she's worked a lot with the staff So particularly with the lunchtime supervisors, who are actually really, really important. They are the staff members in the school canteen when the children are eating. And actually some of these interactions, the way that supervisors talk to children about food and eating, we know can have really positive impacts. So Tash has done some work with them around that, and I know they found that really interesting. It's been really fun to go down to the schools and see bean meals in action and see how excited the children are. I did find myself standing next to a bin at one point. We were actually, believe it or not, weighing the bin to weigh the waste. And I did sort of think, oh, wow, 23 years ago, and I'm back where I started, standing by a bin in a school canteen, but I'm definitely older now, and I hope that I am also a little bit wiser. And we will look forward to sharing these results. We're very busy. Tash has been very, very busy analysing these data, but we will be sharing results as next steps. So we're very nearly at the end. And I just want to finish, I guess, with really some reflections and key values, what I think is important in research. So I think we've established that we're trying to tackle really complex issues, complex systems where we're trying to change things. There are multiple inequalities that we need to think of, and any intervention that we introduce, it's absolutely essential that these interventions are equitable and do not exacerbate the existing inequalities. And I think to do this, we absolutely have to collaborate with others. This isn't something that as individual academics we can achieve on our own. So that will be collaborating with other academics, taking a transdisciplinary approach, but also collaborating very widely through co-production and lived experience research. So working with people with the lived experience who are experts by experience, and also working with the stakeholders, the people who are on the ground actually doing the work. So that is really important. We have to acknowledge and embrace the complexity. We quite like simple stories, but it's never that's never the case, and it's really important that we find ways of navigating the complexity. And I think as academics, a really important part of our role is to share what we found, and the knowledge mobilization, how we share our knowledge and how that is used, is really, really important. And I think traditionally as academics, we would write papers, but actually these are only ever going to be read by other academics because they're really, really not accessible. And this has been something that I've really enjoyed as part of my job, is actually having the opportunity to talk to people about research in varied ways. And I always have really great conversations with people when I do that. And I think there's lots of things that we can do to mobilize our knowledge and share what we find from our research. We often go off to nice academic conferences, which is a nice part of the job. It's really important that we're engaging with policymakers, and I think if we're really going to tackle these such complex systems, then it needs to come from the top. We need policy changes. We need better regulation of the food environment through restrictions on food marketing, for example. And it's really important that we are having these engagements and dialogues with policymakers. So as a group, we've submitted evidence. And last November, I went down to Parliament to give evidence to the Environment, Food and Rural Affairs Committee. I'm really pleased and proud to be a trustee of Feeding Liverpool, who are a really fantastic organisation working locally in Liverpool to tackle food insecurity. And it's great to play a very small part in the work that they do. And public engagement, I think, is such a great part of the job. And one really exciting thing I got to do, Beth and I got to do a couple of years ago, was we got to go to Glastonbury and we did a stand for 5 days to share our urban food growing research. And I also got to headline on the laboratory stage, which was very exciting. And I'm glad I can put that one on my CV. So we have reached the end. I hope that I have kept everybody with me, but if you did get a little bit lost, I guess these are sort of the take-home messages that I would really like you to take from this. So obesity, it's an incredibly complex condition. There are many different causes, and it often occurs alongside mental health problems. And that is why obesity has been so difficult to treat. I've also talked about the food system and how it's really important to situate us as individuals in that broader context of where our food comes from and how it gets to us. And the issue with our food system is it's not delivering on health or environmental sustainability. So our food system is not making it easy for us to eat for public and planetary health. And there are also multiple inequalities in access to nutritious and sustainable diets. So what all of this means is we need multi-pronged approaches. So we need to be really thinking about how we can increase availability and access to healthy food, but we also need to support individual level factors like psychological well-being. So I've talked about a few examples from my own research, growing more food locally, working with retailers and schools. But we do also desperately need these upstream policy changes. We particularly need to see some urgent reform of the welfare system, because this is something that has come out so clearly with the work that I and others have done, is that the incomes that people are receiving as welfare payment just really is not enough to live on. And I think, yeah, what I'd also really like to finish with is just that importance of working in partnership, working with other academics. And I'm so lucky in my career to have worked with so many amazing academics, but also working with our partners, schools, retailers, government, third sector, and our lived experience partners to co-produce research that is meaningful and has genuine impact. Oh, wrong way. So that does bring me to the end. So I really want to thank my family and my friends, collaborators, funders. You can see them on there. There were too many people to name on this slide, but I really want to mention all of my PhD students and researchers, my colleagues at the Appetite and Obesity Group, Professors Joe Harold, Emma Boyland and Sally Sheard for all of the support, Professor Paul Christiansen, who's not here because he's got a broken toe, but for all the amazing stats support, and all of my colleagues in the Department of Psychology, Institute Population Health, all of my amazing mentors, PhD supervisors and external collaborators, our Liverpool Food Growers Network team, the Feeding Liverpool team, and many more. And thank you again for coming tonight. I hope you found it interesting, and I'd be really happy to answer any questions. So thank you.